delivery, values, and the structure of healthcare systems. Today, I'm going to cover the structure of healthcare systems, the impact of power and politics on them, human rights and the relationship between human rights and health. I'm going to use the stolen generation in the Australian context as a case study, and finally make links between human rights and cultural safety in healthcare. So some questions for you. This is entitled Values and the Structure of Healthcare System, and it's because we design healthcare systems to reflect our values. These usually reflect the values of the dominant group in the country. So some questions for you. What do you value in terms of health and healthcare? For example, whose responsibility is health? Is it an individual responsibility, a community, the state, or some combination of the three? What level of healthcare do you think should be available to all Australians? How should tax money be used in healthcare? Should healthcare be available to those who cannot pay? Is there a right to health? Is there a right to healthcare? Should there be? These are some questions for you to ponder. You may want to stop the iLecture and have a think about your values in relation to healthcare delivery. As I said last week, all healthcare systems reflect a combination of government, civil society, and private sector players. Each country's healthcare system reflects different combinations of these groups. For example, in the United States, there has been traditionally a greater emphasis on the private healthcare sector. In fact, for a long time, if you didn't have private health insurance, it would be very difficult for you to receive treatment. Now, United States President Barack Obama has been implementing change in this area, but there has been great resistance because in the United States, there's a strong value placed on small government. In other words, they don't want the government to interfere to a large degree in the private lives of citizens. And for that reason, there's been a great emphasis traditionally on the private sector in healthcare delivery. In the United Kingdom, there's a different combination of interests. There is greater emphasis on the role that government plays in the delivery of healthcare services, in particular the National Health Service, or the NHS. The private sector plays an important and growing role, but it is still, for many people, the NHS is the primary form of healthcare delivery. In Australia, it is a similar scene. Healthcare is divided between the Commonwealth, or the national government, and state governments, regional areas, and is dispersed through a number of different government agencies. In terms of civil society, there is a presence in Australia of international and national non-government organizations, and Australia is a member of a number of intergovernmental organizations such as the World Health Organization. There are also a number of community groups and local NGOs that have formed around particular healthcare issues, and then the private sector plays a role in both of those spheres. In Australia, the healthcare system is divided, as I said, between federal and state government. It is mixed in terms of private health insurance and public health coverage. This diagram there shows private health insurance covered by 32%. According to the Australian Bureau of Statistics, private health insurance is a major contributor to financing health services in Australia, contributing about 11% of national health expenditure. Private health insurance coexists with public funding of health services by the Australian state and territory governments. Private health insurance in Australia has a long history, starting with the friendly society movements of the 1840s. Now, just want to remind you what kind of factors I'm referring to when I talk about structural. So this is from the Sociological Imagination template that you have a copy of in your materials. And of course, the structure of healthcare system is listed there in terms of the roles, the infrastructure, the entire health system. And there's a number of other structural factors that affect people's experiences of health. Now, the structural factors affecting healthcare delivery in all settings, they are important because they talk about how we organize our society. How much money and where the funding comes from? What aspect of our social life is that money diverted to? And it also affects how able governments are to respond to healthcare challenges. So healthcare systems differ country by country in a number of different ways. There may be universal or partial coverage for citizens, people who have insurance or residents. In different locations, different categories of people have different levels of access to healthcare. It may be primarily publicly funded, meaning that the government provides health services and that is paid for by tax, or primarily privately run. Medical professionals in some places are public officials, therefore they are paid for by the government. In other places they are independent practitioners. You can see a difference here in terms of salaries. If medical professionals are seen as public officials, their salaries will be paid for by the government and there will be set levels there. If it is fully in the private sector, there is more variability in what they can charge for services. So therefore, in some instances, medical service costs are fixed, and in other places they fluctuate considerably. Countries also differ in the extent to which the government subsidizes healthcare, which means reducing medical costs met by the individual by government contribution. Now, some important terminology to consider here. This is taken from the Belcher reading in your text, and indeed, the structure of our healthcare system is strongly informed by politics. Who has power? Why do we arrange things the way they do? Who puts their beliefs into action? Who gets to choose how our healthcare systems are structured? There's some key terms we have to clarify here first. I'll start with the state. The state is a term used to describe a collection of institutions, including the parliament, which means government and the opposition political parties, the public sector bureaucracy, the judiciary, the military, and the police. So this term is used for the apparatus, if you like, of the state, the arms of power, so the legal system, the correction system in terms of the police and the military, and the public sector bureaucracy, etc. We use this term more than the term country in the social sciences when we're talking about the power and politics within a particular territory. Ideology in a political context refers to those beliefs and values that relate to the way in which society should be organized, including the appropriate role of the state. And more relevant to our discussion here, including the appropriate role of the state in the provision of health care and the social determinants of health. Now, the market, in terms of capitalism, is any institutional arrangement for the exchange of goods according to economic demand and supply. So here is a chart to show visually what I'm trying to put across. In any particular state, there's a combination of ideology, politics, and economics in terms of making decisions about how the country will be run and how healthcare will be delivered. Now, some people emphasize less state involvement. They say the state should withdraw from the private lives of its citizens, should have a very narrow area of focus, and let the market usually drive the cost of things, the priorities in society, etc. And so here people speak of the right of individuals to spend their income on healthcare or to make their own decisions regarding health and indeed their life in general. On the other hand of the political scale, people favor more state involvement. And so here people talk about the right of individuals in a community to have equal access to high quality medical care. So on this side of the spectrum, the ideology is such that the state should provide for its citizens. It should have a greater role to play in the lives of its citizens. So you end up with some political philosophies here. On the one hand, you've got socialism, a political ideology with numerous variations, but with a core belief in the creation of societies in which private property and wealth accumulation are replaced by state ownership and distribution of economic resources. So in a socialist state, you would take in money through taxation. There might be quite high levels of taxation, and that money is then dispersed within the population to try to reduce inequities in access and therefore to look after the population. On the other hand, with liberalism, it is an ideology that regards the interests of the individual and their position in the marketplace as being of primary importance. And this is based, of course, on individualism, a belief or process supporting the primacy of individual choice, freedom, and self-responsibility. Now, in very general terms, I would again use the example of the United States as a state that is influenced by individualism, liberalism, and promotes less state involvement in the lives of its citizens. The Nordic countries, particularly Norway, Sweden, Denmark, move towards a socialist approach where there is high taxation but also a high level of healthcare provided to citizens. Now, countries will work out their particular ideology, their stance in relation to economics, the role of the state and the role of the citizen. And it's based on values. What should the relationship be between people and the state? Can you fit Australia within this scheme? How would you describe the Australian system? Now, as is pointed out in the reading for this week, what we're looking at here is part of a new and rapidly growing field, which is positing a relationship between human rights, social justice, and health equity. Let's look more closely at this. Now, Kofi Annan, the former Secretary of the United Nations, said that health will finally be seen not as a blessing to be wished for, but as a human right to be fought for. And here, health is seen as a human right. This is a very different way of describing it. Rather than fitting it into this schematic of the relationship between state and individuals, we're now looking at it as human rights. And as a set of values, human rights describe a particular relationship between individuals and the state. According to the Australian Human Rights Commission, human rights are about recognizing and respecting the inherent value and dignity of all people. Human rights standards are contained in internationally agreed human rights treaties and declarations. The Australian Human Rights Commission is responsible for promoting and encouraging protection of human rights in Australia. So that first sentence is key. Human rights are predicated upon this quality that humans are presumed to have, an inherent, meaning built into being human, value and dignity. And because of that, it is then thought that there are certain standards, that humans are owed certain things, and they owe each other certain things, certain social goods, because they are human. And in this case, in Australia, the Australian Human Rights Commission is the institutional body that oversees the promotion and protection of human rights in this country. So rights in your text is described as socially prescribed privileges and entitlements for individuals and social groups. Now, I love to talk about human rights. I find them fascinating, and when I hear people talk about human rights, I get the warm fuzzies. Yes, I think, yes, the human rights for people, and I find it a very powerful language and a very emotive language. But what fascinates me about human rights is that they're very complex. They're not straightforward. In fact, sometimes they contradict. What do you do when one person's right to this and another person's right to this contradict each other? Who decides? Also, human rights, as I'll say further in a moment, is a very powerful moral language, but often we don't have the way to implement them. It is not so clear always who's going to protect them, who's going to enforce them, or encourage the circumstances to promote human rights. So therefore, in reality, human rights can be very complex and quite messy. So we need to clarify a few more terms to fully understand what we mean by rights. The first one would be health inequality. Now this refers to the fact that different people experience different levels of health. So life expectancy, their experience of health and illness will not be the same. So therefore, there is health inequality. And in the text, it is defined as inevitable, given genetic variation, lifestyle choices, and socioeconomic differences among the population. So we are diverse. Any population differs in terms of age, gender, usually socioeconomic status, and in today's society, ethnicity. There's a number of different factors. If you have an indigenous population, that is quite a different experience than other groups of people within a state. And so because of this variation, there will be health inequality. However, health equity is a different question. Equity has to do with fairness, the application of principles of justice to correct or supplement the rules of law. And as you see, this whole discourse of human rights, we're drawing from law and from political philosophy. And so it's quite interesting to bring that discourse into health. So health equity, therefore, is a situation in which groups with different levels of advantage or disadvantage, such as wealth, power, or prestige, do not experience health inequalities associated solely with social positioning. So this is more to do with, is it fair? Yes, we have differences, and they will happen. When it comes to genes, there may not be a lot that we can do about it, but there may be some factors where we could have an effect. It could be policies that are causing different health outcomes. Is that fair? And therefore, could we pass laws, or could we have policy, or could we rearrange some of our structure in society to reduce that, to make it more equitable? And here we have the idea of social justice, the improvement of a situation of disadvantage by the redistribution of goods or resources. And in fact, there's another definition that I like. This is by Germov. He says, social justice is a belief system that gives high priority to the interests of the least advantaged. So you can see that this discourse is one that is more is arguing that the state do something about health. Because who's going to implement the policies? Who's going to make change? Who's going to redistribute some of the social goods in society? The body that we look to at the moment and over the last few hundred years to do that is the state. So where did human rights come from? How long has this kind of this idea been around, and what does it mean for Australians? Well, the main source of human rights is the International Bill of Human Rights, and this refers to a collection of agreements. The first one is the Universal Declaration of Human Rights, or UDHR, 1948. Then there were two covenants which expand upon and clarify the UDHR. One of them is the Covenant on Civil and Political Rights, ICCPR. We get a lot of letters here. And the Covenant on Economic, Social and Cultural Rights, ICESR, both of which were formed in 1966. And the UN Charter also sets out a set of agreements relating to human rights. If you notice the dates, 1948 to 1960, you can really date the human rights discourse to the end of the Second World War. There were some notions of fairness earlier than that, back to the French Revolution and back to early Greek thought, if you like. But really the human rights discourse has its origin in the Second World War. What happened in World War II was so horrific, and particularly the state having such devastating control over individuals in terms of the concentration camps in Nazi Germany, that people said this can't happen again. The genocide that happened there, or the attempt to completely wipe out a group of people, was horrific to the world community. But there were also, it was Jews, gypsies, homosexual people, a range of different people that the German state decided were unacceptable, and that it put all of the state's mechanisms of power into eradicating these groups in society, or at least reducing their power. So the world community came together after the Second World War and passed the UDHR. When it comes to health in particular, we need to look at Article 25, which states, everyone has the right to a standard of living adequate for the health and well-being of himself or herself and of his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control. Now, we didn't have gender-inclusive language in 1948, so you can see that this uses the male pronoun throughout. But the main point I want to make about this is the standard of living. This is a lot more than just talking about healthcare services. This is a broader definition of health, and in fact covers many aspects of social life. After 1948 and the passing of a number of these covenants, human rights talk entered the public discourse. In fact, lots of people, I have a right to do that. Don't tell me not to do that. I have a right to. It is now part of our day-to-day speech. But what's interesting is a lot of people don't have a clear idea about human rights and what that means, the implications of this idea of human rights for themselves and for others. So the UN Universal Declaration of Human Rights sets out 30 articles to do with human rights. And I would look at page 282 of your text for a summary. And some of these include a right to be free from torture, slavery, a right to be equal before the law, a right to freedom of thought, a right to privacy. And as I said, the two covenants there expand upon, clarify the UDHR, and talk about some of the reporting mechanisms, the monitoring process that will be implemented. And the Covenant on Civil and Political Rights, for example, talks about the right to equality, the security of person, the right to be free from hunger. There's one directly related to health, the right to education. Now, what's interesting to note about rights is we talk about 3 generations of human rights. As I said about culture, no idea stands static over time. It changes. And the rights talk has changed historically and continues to evolve today. We tend to talk about 3 generations of rights. These are like groupings of rights that came one after another. Now, they all coexist. So we still have the 1st generation rights while we have the 3rd generation rights. But there are particular differences between the 3. And some are much more powerful in terms of the extent to which people are protected. These rights are protected and provided for. Let's have a look. So 1st generation rights are those related to civil and political rights. And this discourse evolved in the 18th century and has to do with liberty or freedom. And again, this is about protecting the individual from the excesses of the state. Sometimes these are called negative rights because a lot of it is about the state pulling back from or not having anything to do with or not interfering in the lives of individuals. Some of the important votes here include the right to vote, the right to assemble, which means gather with people for largely political purposes, the right to free speech, the right to a fair trial. So that might involve an independent judiciary, evidence, etc. But other ones that are included here, the right to privacy, freedom of religion, freedom of movement and assembly, freedom from arbitrary arrest. So a lot of these are to do with civil and political, so participation of individuals in the political public life of a country and the way the state functions. These are very much focused on individual rights, individual mental rights, in fact, in many ways. Now, 2nd generation rights include economic, social, and cultural, and they became more prominent in the 19th century. These are sometimes called positive rights because it involves someone to do something, to actively do something to help provide for these rights. So, as I say here, it asks governments to improve people's overall social situation. So some of the second generation rights include the right to education, the right to housing, and social security. So for example, the right to housing. If we say there is a right to housing, the government needs to do something to ensure that people have housing. And not only that they have a house, but they have a house adequate to provide for their needs and to create a healthy environment for them to live in. These are less popular by some states because it requires governments to do something. They have to pay, they have to organize, they have to prioritize, and yes, they'll have to redistribute the income gathered through tax and other sources in order to meet these positive rights. 3rd generation rights are collective rights, and these became prominent at the end of the 20th century. Some of these include the right to economic development, prosperity, social harmony, healthy environment. Other ones include the right to natural resources, to communicate, cultural heritage, to participate in cultural heritage, rights to intergenerational equity, sustainability. Now these are harder for some people to get their heads around. We're no longer talking about individual but collective. And indeed, many of the good things in life can't be enjoyed as individuals by yourself. The only way they can be enjoyed and the rights can be fully exercised is with other people in a collective sense. These have not been incorporated into most human rights treaties, and there's the least state support for 3rd generation rights. Now, many people would argue that, for example, Indigenous people would argue that 3rd generation rights are incredibly important. In fact, in some cases more important or very complementary to civil and political rights. But this is, again, a cultural phenomenon. Human rights came out of a particular time, a particular place, and they reflect the priorities of state governments at the end of the Second World War and the political movement globally, but particularly in Western states from the 18th to the 21st century. So what I want to draw your attention to, this definition of social determinants of health, of course, from the World Health Organization, the Commission on the Social Determinants of Health. You've seen this since week 1. And this, when you look at it, very much relates to second and third generation rights. So the social model of health is drawing our attention to second and third generation rights and some of the things that we need in order to live a healthy existence. And I'll remind you too that in lecture 1 I said that the social determinants of health affect our access and control over our understanding of what factors are impacting our lives, the information, the knowledge that we need. As Foucault would say, knowledge is power. And so who has access to power? What is the information? Is it being shared? What information is being prioritized over other information? Over services, decision making, the options that people have, and the resources. So this debate about health and human rights involves these very powerful issues. So the relationship between human rights and the social determinants of health is clear. And in fact, I encourage you to look at table 17.1 in your text that links health determinants and international human rights conventions. And in particular, in detail, it goes through income and poverty, living conditions including food, water, sanitation, and housing, employment and occupation, education, culture and ethnicity, gender and age, population-based services and facilities, social cohesion and social support, social determinants of health. So there is a direct mention of many of these social determinants of health in rights treaties. But is there a right to health? Well, again, in your text, this is the article by Tackett. This is Article 12 of the Convention in Economic, Social, and Cultural Rights. And it says here, the states parties, because of course the people who sign these treaties are state governments, to the present covenant recognize the right of everyone to the highest attainable standard of physical and mental health. You do note it doesn't add spiritual, emotional, or other ways to understand health, but physical and mental health. The steps to be taken by the states parties, in other words, what do governments have to do to the present covenant to achieve the full realization of this right shall include A, the provision of or the reduction of the stillbirth rate and infant mortality and the healthy development of the child, the improvement of all aspects of environmental and industrial hygiene, so you're getting into public health infrastructure there, the prevention, treatment, and control of epidemic, endemic, occupational, and other diseases, the creation of conditions which should assure to all medical services and medical attention in the event of sickness. So that one is much more about healthcare provision. Now, Mary Robinson, I've got the quote here as well, the previous UN High Commissioner for Human Rights, her response to this is, the right to health does not mean the right to be healthy, nor does it mean that poor governments must put in place expensive health services for which they have no resources. But it does require governments and public authorities to put in place policies and action plans which will lead to available and accessible health care for all in the shortest possible time. So this is her attempt to be realistic. Not all governments have high taxation. Not all governments are functioning to the point of being able to bring in tax, prioritize spending, and redistribute that money through public services. And different governments that signed these treaties, they're positioned very differently in terms of their ability to bring these aspects into effect. And that's very much what the essay for this unit is about. You may have a set of agreements or moral paradigms or a set of goals internationally, but different states differ in their ability to achieve those goals. What she's mainly emphasizing here is that governments should prioritize this and try as much as possible to provide people with access to health care and the social determinants of health. So some of the implications for health advocacy of the human rights discourse. Well, as I've mentioned, health is mentioned in many human rights treaties, particularly Article 25. States need to sign and then ratify treaties. Now, this refers to the fact that the process for human rights is that the treaty is put forward at the United Nations or in other bodies, but primarily the UN. The heads of state sign, so now it would be at this contemporary moment, the Prime Minister of Australia would need to sign the treaty, then ratify the treaty, and then they implement it. So implementation is sometimes where things fall down. You may have signed a treaty internationally, you know, yeah, that's great, you've signed it, you get a lot of kudos or praise for doing that, but then sometimes states don't implement it domestically. They don't do anything inside the country to put that treaty into effect. Now, states also differ in terms of how they should put treaties into effect. So one would be through domestic law. You pass laws that help implement the treaty. For other people, it's through the legal form of common law or the evolving jurisprudence of judges. For some, it is through policy. So that's separate from the area of law, but is in the realm of policy and regulations for government agencies, for example. But the tricky part is that there's no enforcement body. States are in control. And in fact, the whole rights system and the international governance system is based on the idea of state sovereignty, based on the idea of states. We have countries, the map is divided into countries, and they have control over what's going on inside their borders. And so again, it's difficult for the international community to enforce it because it's up to a state to enforce it. And often they'll tell the international body not to interfere. So human rights have a great moral force, but less of a legal impact globally. So some of the challenges: yes, rights treaties are moral, but they're not legally binding. More and more people are arguing, though, that rights treaties equal customary international law, which means that it is a law that evolves and that countries are bound by it. Now, rights are divided into absolute rights and relative rights. Absolute rights are ones which no limitations or restrictions can ever be placed on them. So freedom from torture, slavery, or servitude and the right to a fair trial are thought to be absolute rights. In no circumstances should those rights be set aside. And then there are relative rights. And relative rights at times can be restricted. Now, to give you one example of a relative right, it would be freedom of speech. Now, if I belong to a group that is identifying one ethnic group that I hate, and I'm going to publish material against that group, my right to freedom of speech is countering someone else's right to be free from hate crimes, from hatred, from thinking or speaking in a way that could promote genocide or discrimination or exclusion. So there needs to be a weighing up. Whose right? Freedom of speech or freedom from this kind of discrimination and hate literature? There need to be restrictions. Also, some rights of individuals are ignored or set aside, if you like, when there's a state of emergency. So if something is happening within a state, sometimes rights are set aside for the greater good of all people. This is how it's argued, because of state security. But rights are also interconnected. Securing one relies on securing others. And sometimes also you need one right to enjoy another. It's great to have a right to education, but if you don't have any food and you don't have a house and you don't have any social cohesion, things are chaotic in your area, are you going to be able to take advantage of the right to education? No. And again, sometimes rights contradict each other. How do you decide which right trumps the other? Now, the word trump is coming from the card game bridge, but this is often used in a legal context. The idea is in bridge, when you play the trump suit, so let's say it's hearts, when you play any of the trump cards, they're stronger, they win over the other cards. So there's this discourse, talk about sometimes, do some rights trump others? That as soon as I say, I have a right to, and that means that other rights have to give way to my right. And there's a lot of debate about trump rights internationally. There's also a debate about whether human rights are culturally informed or universal. When you hear the inherent dignity of the human being, and some of the language in the preamble, for example, to the Universal Declaration of Human Rights, it seems to be something that all human beings have everywhere, all the time, because they are human. And this is an idea about universal, meaning the universe. Everywhere Human beings are generally the same, and therefore they all have human rights. Other people argue, no, human rights came out of a particular historical time. They prioritize certain values, and those values come from Western states, European, English, that area of the world. And because they dominated the United Nations in the 1950s, their concept of rights has become entrenched, and now it's being exported to other parts of the world. And some people have argued that it clashes with other cultural traditions. So there's some very interesting literature on whether rights are universal or culturally informed. So some questions for you at this point in the lecture. What do you think are our human rights? Which are the most important human rights to you? Do you think there are countries in which human rights are completely respected? Can you name your human rights? To whom do you turn if your human rights are violated? You might want to pause the lecture and the various human rights treaties we have on the international stage. We now also have the concept of the Millennium Development Goals. Now again, I draw your attention that these goals came from the United Nations, the same body that signed and promoted the earlier human rights treaties. And these 8 goals that we look at in this unit give you a particular framework of the priorities, the values at an international level in terms of healthcare and health. And all the signatory countries, the states that have committed to implementing the Millennium Development Goals, have also agreed to take these values and implement change within states to bring them about. So I'd like to turn now to the case study of Indigenous peoples, and in particular of Aboriginal people in Australia. Now this is a quote by Dr. William Jonas, the past Aboriginal and Torres Strait Islander Social Justice Commissioner. He says, "For Indigenous peoples to participate in Australian society as equals requires that we be able to live our lives free from assumptions by others about what is best for us. It requires recognition of our values, culture, and traditions so that they can coexist with those of mainstream society. It requires respecting our difference and celebrating it within the diversity of the nation." So here we again turn to values. What I see in this quote from an Aboriginal or Indigenous perspective is that people have values. They want to live on the basis of those values. They want to live in celebration of their culture and traditions, and they want to be able to be free of the assumptions or the domination as well of others and telling them what is best for them. They want to live out of their values actively. It requires respecting difference and celebrating. This is indicating that one size does not fit all, and that within the state there may be several nations or groups of people who have sets of values that they wish to live by. Now, unfortunately, the history of Australia tells us quite clearly that this has not happened for Aboriginal people. And one of the main areas where it hasn't happened is the stolen generation policy. And this involves the forced separation of children from their families, the removal in quite horrific ways of children from their parents. Now, these children were often told that their parents were dead, and parents did not know where their children had gone, and so there was a severance, a cut within the family unit, within the community, within Aboriginal culture, because of this drastic separation. And the children are called the stolen generation. It has been argued that this policy, which lasted until the early 1970s, so I don't want to date myself, but that would be me, breached the human right to health. Mental health and at-risk behaviors are higher among those removed. But court cases seeking compensation on these grounds failed. So let's think about this for a moment. What happened to these children? When they were stolen or removed, they were put into institutions to teach them how to be white, or to teach them how to assimilate or blend into mainstream Australian society at the time. And people, you can see this little girl in the one photo, she has an X on her skirt. And the comment there says, "I like this little girl in the center of the group, but if taken by someone, anyone else, any of the others would do, as long as they are strong. And this relates to the fact that the plan was to take these children, particularly children of so-called mixed parentage, so an Anglo and an Aboriginal background, and make them into white people. And this picture, the other picture there of the 3 generations, to show that you could breed out Aboriginality over time to produce people who look white, who act white. And in terms of working hard, the girls were trained as house domestics, the boys as farmers and other useful service roles within the economy. Now, when you read the literature and even hear quadroon, octoroon, half-blood, this sounds very much like cattle farming. Yes, we're talking about eugenics, about breeding, mixing up people and breeding people like animals to have a particular outcome. And interestingly, this policy going on into the 1970s, so many people today would be the first generation within the stolen generation, that this is in direct violation of Aboriginal people's human rights. It was overseen originally by the Aborigines Protection Board, and the power was to remove children without parental consent or a court order, so beyond the judges as well. It went on from 1909 to 1969, although as noted here, it continued on into the early 1970s. Now, in a report, Bringing Them Home, issued by the Australian Human Rights and Equal Opportunity Commission, otherwise known now as the Australian Human Rights Commission, following an inquiry in the 1990s, found that this policy was devastating for Aboriginal people. The children were often abused mentally, sexually, physically, emotionally. There was massive culture loss, language loss, traditions, oral history, let alone the I would think the fundamental human right to be raised by your own family and to experience a family surrounding. It has been argued that this highly assimilationist policy, which segregated or separated groups of people, was in effect a form of slavery and certainly inflicted trauma upon the parents and the stolen children. It is said to be in direct contradiction to the 1948 Convention on Prevention and Punishment of the Crime of Genocide, which Australia had signed. And the health effects of this have been ongoing. For example, yes, we've got higher at-risk behaviors among those who were removed, and their children, and their children. For example, how do you parent effectively if you've never been parented yourself? If you were raised in an institution with a lack of loving social support, of close or extended family members, how can you be an effective parent yourself? How can you live a life free of drug and alcohol dependencies if that has been a major coping mechanism from intergenerational trauma? So starting with the very early judgment by the English colonizers that Australia was empty land. It did not have people on it living in a way that they recognized. They did not see ownership of land because of the very late citizenship given to Aboriginal people. In fact, for many, many years until the 1960s, Aboriginal people were classified as flora or fauna in the Constitution. Because of a continued lack of constitutional acknowledgement of Aboriginal self-determination and the absence of treaties. Because of this, the stolen generation has had a huge impact on Aboriginal people and has been a gross violation of individual and collective rights. There finally was a national apology to the stolen generations in 2008 by then Prime Minister Kevin Rudd. And he talked about the rivers of tears that flowed from the stolen generation policy. Well, that river has not dried up yet, and it won't in the near future either. It was finally recognized that Indigenous human rights were violated by the government decision. We're into the Northern Territory intervention. What's really interesting that right around this time when we've got the apology happening, we also had the Northern Territory emergency response. So despite the awareness that the stolen generation had had such a negative impact on Aboriginal life, there was a Northern Territory emergency response. Now I'm quoting here from Beckerman from the book Benangunj. So what happened was, from 2001 onwards, numerous reports and a great deal of media coverage identified increasing levels of disease in Aboriginal communities. Such disease was linked to deteriorating housing, poor health, rising unemployment, and continued undereducation, which expressed itself in violence towards self and others, child abuse, drug abuse, truancy, and continuing high rates of suicide. Now, many of these behaviours could be linked directly to the Stolen Generation policy. The government's response was to enact the Northern Territory Emergency Response, or NTER, also known as the Intervention, on the 21st of June 2007. This was right before the 2008 apology. The NTER, which received bipartisan support, so both sides of the political spectrum, set out to protect children, make communities safer, and create a better future for such communities. Now, interestingly, this was very much the thinking that led to the Stolen Generation. Many people at that time thought they were helping, civilizing Aboriginal people, that they would benefit from white culture. 73 Aboriginal settlements or town camps or prescribed areas, which included some 64% of Aboriginal people living in the Northern Territory, were identified for specific intervention. As these regulations would be applicable only to Aboriginal people, the federal government suspended the Racial Discrimination Act, while the Northern Territory government suspended its own Anti-Discrimination Act. So interestingly, these two human rights pieces of legislation, the Racial Discrimination Act and the Anti-Discrimination Act, wouldn't have permitted the Northern Territory emergency response. So here's a case of where the state government suspends or ignores or sets aside one set of rights in order to implement some policy. What was the result? The Northern Territory Indigenous leader and former Territory MP John R. Kitt labelled the intervention genocide. Jones, a pediatrician with many years of experience in dealing with the victims of child abuse, maintained that the NTER seemed more characteristic of a police state than an attempt to intervene in order to provide long-term solutions and support. Now, a couple points I want to raise about the Northern Territory emergency response. One, how ironic that Indigenous human rights were violated by suspending a bunch of other human rights, but they were supposedly protecting some rights, the rights of children to be free from abuse and some other rights. It gets very confusing in this rights talk, and it is quite slippery when governments can simply ignore or do away with a set of rights. Shouldn't they stay in place? If you're removing racial discrimination legislation, doesn't that indicate that you are discriminating racially? Which, in fact, was the case. It's also disturbing, in many of these, the army entered into Aboriginal communities to intervene in situations of alleged child abuse. There are parallels here that have to be drawn to the earlier policy of the Stolen Generation. So in this case, this is many, many years after the Universal Declaration of Human Rights, many years after rights talk became part of public discourse, and here's a case where a government, again, is acting to protect human rights, perhaps by violating human rights and by ignoring human rights. Very confusing and complex situation. Now, I want to just draw this final part of the lecture into the discussion of healthcare. This is also from Eckerman, page 128, and it's an interesting description of cultural differences from people to people. Now, we talk a lot about language and even clothing or food as important aspects of culture. But what I like about this diagram is it shows the extent to which culture informs a whole range of very significant human behaviors. So yes, we have a whole style of verbal cues, how fast we speak, the type of words that we choose, how we respond to questions, when we're quiet, the tone of voice that we use, etc. And then nonverbal. Eyes, body, hands, a number of things that we use, touching, personal space. Then rules and conventions. How should we interact with people? How should we speak? How do you greet? How do you show respect? A number of different issues there. And interestingly, at the bottom is obtaining consent, which has implications for a medical context. And then etiquette, what is acceptable and approved behavior? And again, here we have greetings and leavings, how you invite people, how do you interrupt, a lot to do with communication. Now, when you look at the fact that healthcare systems reflect the values of a dominant group, and the dominant group's cultural behaviors covering this broad range of activities will be implemented and visible through that healthcare system. If you have a different set of cultural verbal cues, nonverbal behavior, rules and conventions, and acceptable behavior, when you enter into that other sphere, it's going to be perhaps quite upsetting. You may experience culture shock. If the medical system in Australia reflects the values of the dominant group, so this is the Anglo-Celtic cultural group, then therefore for Aboriginal or Indigenous people entering into that context, in these many different ways, they will find it foreign, or perhaps find it foreign. And I want you to revisit the cultural safety principles I talked about in the second lecture, Anthropology and Health. According to the Nursing Council of New Zealand, 2005, health professionals should reflect on their practice. How do I behave? How do I interact with other people? How do I help create a culturally safe or unsafe environment? Seek to minimize power differentials between yourself and your patient. And part of that is recognizing that if you come from the culture that is the basis of the system of healthcare, you will be far more confident, more powerful, more knowledgeable, more able in that context than may be many of your patients. Engage in a discourse with your patients. Talk to people. Listen to them. Try to understand their worldview. And in fact, in this unit, even understanding that people have a different, very different worldview from yourself can be quite an amazing recognition, realization. Undertake a process of decolonization, which is recognizing the impact of the past on health outcomes. And as I've made the case with the Stolen Generation Policy, the Northern Territory Emergency Response, you need to understand the impact of those policies on patients today. Yes, and in fact, Aboriginal patients tomorrow as well. Ensure that you do not demean or disempower others through your actions. So how useful are rights? We saw in terms of the Northern Territory emergency response that sometimes rights can disappear and be suspended. In other times, we see members of the population that don't have access to their human rights. They're being violated all the time by governments or by groups of people within a country. This, according to the World Health Organization, overall, human rights may benefit work in the area of public health by providing a tool to enhance health outcomes through using a human rights approach to designing, implementing, and evaluating health policies and programs. An empowering strategy for health which includes vulnerable and marginalized groups engaged as meaningful and active participants. So you notice the language here, engage, determining, designing. This isn't just about delivering culturally safe healthcare, but it's also got implications right back at the beginning for our values, our design of healthcare systems. Human rights provides a useful framework, vocabulary, and form of guidance to identify, analyze, and respond to underlying determinants of health. If nothing else, it draws our attention to the social determinants of health. And finally, human rights provides a powerful, authoritative basis for advocacy and cooperation with governments, international organizations, international finance institutions such as the World Bank or IMF, and in building partnerships with relevant actors in civil society. So the World Health Organization does indeed see a relationship between public health and human rights. So, to remind you here, at the purpose of this lecture, it's entitled Values and the Structure of Healthcare Systems. And what I've tried to communicate in this lecture is that our healthcare systems reflect our values. They don't always reflect, however, the values of all people within a state. They reflect the values of the dominant group within that state. So, to remind you again the questions I asked earlier, whose responsibility is health? Individual, community, or state? What level of healthcare should be available to Australians? Should the market drive healthcare services, or should there be some government protection from the fluctuations of the market? Should we all have access to the social determinants of health? Who decides what the healthcare system looks like? Who has a say in the design and delivery of healthcare? Does the healthcare system reflect the values of Australian society? Does it reflect the values of Aboriginal and Indigenous peoples? Is there a right to health? In reality, is there? Is there a right to health care? Should there be? And finally, is there a right to culturally safe healthcare in Australia? This brings us to the end of Module 2, the 2 lectures and weeks of activities that looked at healthcare delivery. To remind you, the learning outcomes for this module include understanding the structural factors affecting healthcare delivery in all settings, understand more fully the role of non-government organizations or NGOs in developed and developing country settings, critically analyze the relationship between health and human rights and the distribution of humanitarian aid, and finally reflect on the contribution healthcare professionals make to these organizations. You may want to look further into some of the sources I used for this lecture, and I encourage you to look at the readings for this week as well. Thank you very much for listening.